This video is for educational purposes only and does not constitute legal advice. It is recommended that you seek legal counsel for specific matters. No copyright infringement intended.
HIV is one of the public health crises in many countries and has socio-economic, employment, and human rights implications. One of the most effective ways to reduce and manage the impact of HIV is by creating awareness. Good day, my name is Pamela Yvonne Sonsona, a student nurse from Brokenshire College, and let's talk about HIV. So what is HIV? HIV stands for Human Immunodeficiency Virus. It is an infection that attacks the body's immune system, which are the cells that help our body fight infection, making a person more vulnerable to other infections and diseases. How did HIV started? According to CDC, Centers for Disease Control and Prevention, this started earlier around the 1800s in Central Africa. Please don't make hastily generalizations. This is where it started, but it doesn't mean that if you're from here, you have HIV already. Before HIV is transferred to humans, this virus first started from a type of chimpanzee in Central Africa. It was named Simian Immunodeficiency Virus of chimpanzees before it changed into HIV. But how does the virus transfer from chimpanzee to humans? This is because they hunt and butchered chimpanzees and they ate it. It was probably passed to humans when they started hunting these for meat and came in contact with their infected blood. And over the decades, HIV slowly spread across Africa and later into other parts of the world. According to WHO, World Health Organization, in their latest HIV data and statistics, 37.4 million people globally were living with HIV in 2021. There are two common stereotypes of HIV, and these are HIV-1 and HIV-2. HIV-1 worldwide, which has a worldwide distribution, and HIV-2 Africa, which is primarily confined to Africa. What are the signs and symptoms of HIV? This depends on the stage of infection. The first stage is the acute HIV infection. This lasts for a few weeks and has the risk of being overlooked as symptoms may be similar to flu. The second stage is chronic HIV infection. This lasts up to 10 years, asymptomatic, no symptoms but has swollen lymph nodes and other clinical manifestations. The third stage is the acquired immunodeficiency virus or AIDS. This is the last stage of HIV infection. This is asymptomatic and has more severe consequences to immune system, damaged lymph nodes, and tissues. How do you get HIV? HIV can be found in blood, semen, breast milk, vaginal fluids, and anal mucus. It can be passed on when these fluids enter into another person's body, for example, through sex. The virus in someone's vaginal fluids or semen can pass into their partner's body through the mucous membrane of their vagina, anus, or the top of their penis. Once the virus is in their blood, it makes copies of itself. HIV can be also passed on from mother to baby during pregnancy, birth, or breastfeeding, unprotected sex, blood transfusion, or by sharing injecting equipments. It cannot survive outside the body. So, you can't get HIV by touching, hugging, kissing, from coughs or sneezes, or by sharing food. If you think that you've exposed from HIV, the only way to know and to make sure is through proper testing. HIV treatable? What are its treatments? There's currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. There are medications that can control HIV and prevent complications. These medications are called antiretroviral therapy or ART. Anyone can get HIV, but you can take steps to protect and prevent yourself from getting it. use condom during sex, get tested for HIV, limit your number of sexual partners, post-exposure prophylaxis or PEP, pre-exposure prophylaxis or PrEP, never share needles or other injecting equipments. Just like any other diseases, there are many ways to prevent HIV. We just need awareness and enough knowledge about it. Just remember, prevention is better than cure, especially when something has no cure.